Hi, good morning Naxon. My name is Mihira. I'm your invigilator for the OET-speaking session on the 27th of August 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Naxon Mayer.
Okay. What is your candidate number, please?
My candidate number is 325000325.
All right. Are you taking this test as a doctor?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
Why do you want to become a doctor?
I want to become a doctor because I have always been fascinated by the human body and how it works. I enjoy learning new things and solving problems, and I find medicine to be a challenging and rewarding field. I also have a strong sense of empathy and compassion, and I want to use my skills and knowledge to help people improve their health and quality of life.
How do you handle stress and pressure in your work environment?
I handle stress and pressure in my work environment by prioritizing my tasks, managing my time effectively, and delegating when necessary. I also try to maintain a positive attitude, communicate well with my colleagues and patients, and seek feedback and support when needed. I also make sure to take care of my physical and mental health by exercising regularly, eating well, sleeping enough, and engaging in hobbies or activities that relax me.
What are some of the current trends or developments in your field of expertise?
Some of the current trends or developments in my field of expertise are the use of artificial intelligence, big data, and machine learning to enhance diagnosis, treatment, and prevention of diseases, the advancement of personalized medicine and genomics to tailor therapies based on individual characteristics, the integration of telemedicine in digital health platforms to improve access and delivery of care, and the promotion of interdisciplinary collaboration and innovation to address complex health challenges.
How do you deal with ethical dilemmas or conflicts in your practice?
I deal with ethical dilemmas or conflicts in my practice by following the relevant laws, regulations, policies, and codes of conduct that govern my profession. I also consult with my seniors, peers, or ethics committees when necessary, and respect the opinions and values of others involved. I always try to act in the best interest of my patients, while balancing their autonomy, beneficence, non-maleficence, and justice.
How do you communicate with patients from different backgrounds, cultures, or languages?
I communicate with patients from different backgrounds, cultures, or languages by being respectful, courteous, attentive, and empathetic. I use clear, simple, and appropriate language, and avoid jargon or technical terms. I also use visual aids, gestures, or translators when needed to facilitate understanding. I try to learn about the patient's beliefs, values, preferences, and expectations regarding their health and care, and accommodate them as much as possible within the scope of my practice.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good day, I'm Dr. Naxon Mayer. How can I assist you today?
Hi doctor, I'm worried about brain aneurysms. My father had one, and I've been having severe headaches lately, along with some vision changes.
I understand your worries. I'm here to help. Well, how can I address you?
My name is Mihira.
Mihira, let's start by discussing your concerns. You mentioned severe headaches and vision changes. Could you tell me more about these symptoms?
Yes. Doctor, occasionally I've felt some numbness in my face. No other symptoms.
Thank you for sharing that. It's essential to understand your symptoms. Now, I'd like to explain what a brain aneurysm is. Mihira, it's like a weak spot in a blood vessel wall, which can lead to a bulge, or even a rupture.
I see. That sounds serious.
Yes, it can be. Given your family history, like your father's diagnosis, it's important to be aware of the risk factors. Smoking, high blood pressure, certain medical conditions, and age can increase the risk of brain aneurysms. Mihira, have you smoked, or had high blood pressure?
I used to smoke, but I quit a year ago. My blood pressure has been slightly high recently.
Quitting smoking is a positive step. We should monitor your blood pressure. Now, let's talk about other risk factors. You mentioned your father's aneurysm, which is a significant factor. Smoking is another risk factor, and high blood pressure can contribute as well. Additionally, certain medical conditions and age can increase the risk.
What should I do, doctor?
Mihira, I'd like to recommend an MR scan, which stands for Magnetic Resonance Angiography. It's a non-invasive test that uses magnetic fields and radio waves to create detailed images of blood vessels.
Why do I need this scan?
Mihira, an MR scan can help us visualize the blood vessels in your brain and detect any abnormalities, including aneurysms. Early detection can lead to timely intervention and better outcomes. Do you have any concerns about the scan?
I'm worried about the procedure itself.
I understand your concern. The MR scan is painless and usually takes around 30 to 60 minutes. Trained professionals will guide you throughout the process, ensuring your comfort and safety.
All right. That's fine.
Do you have any specific questions or worries about the MR scan or the process?
Well, I'm not sure what to expect during the scan.
I'm here to explain everything. During the MR scan, you will lie comfortably, and there will be no pain involved. You might hear some noise from the machine, but that's normal. Trained technicians will be with you the whole time to ensure your well-being.
Okay, that's fine.
Great. Mihira, let's discuss scheduling the MR scan. What's your availability like, and do you have any preferences regarding the appointment time?
I'm pretty flexible. Whatever works for you.
Excellent. Our scheduling team will find a suitable time for you. Before the scan, you may need to follow some dietary and medication restrictions. Also, please wear comfortable clothing without metal items.
Got it. Thank you for explaining everything.
You're welcome. To summarize, we discussed your concerns, risk factors, the importance of the MR scan, the procedure's details, and now the scheduling and preparation. If you have any more questions or concerns, please feel free to reach out.
Thank you for your help, doctor.
You're welcome. Take care, Mihira, and we'll be in touch soon to schedule your MR scan. Have a good day. If you have any more questions, don't hesitate to contact me or call our facilities helpline.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihira.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.